Today in series of Docplexus KL interviews, we have with us Dr. Shashank Shah. He's a renowned laparoscopic bariatric surgeon who has more than 26 years of experience in his field. Currently, he practices at the Laparobesso Center Clinic in Pune and at Lilavati Hospital in Mumbai. His research has contributed significantly to the research for therapeutic interventions in his field of uncontrollable diabetes. Dr. Shah is a recipient of the American Diabetes Association's prestigious Vivian Fonseca Scholar Award for his research on type 2 diabetes in the South Asian population. He is also the president of All India Association for Advancing Research in Obesity, Obesity Surgery Society of India and International Excellence Federation India chapter. Thank you, doctor, for this interview. So let's begin with the first question. What is the role of gut microbiota in obesity and diabetes?
Gut microbiota actually play an important role in absorption and immunity of an individual. Gut microbiota also varies from country to country, and various external factors can modify this gut microbiota, and it is now understood that they would have a major role in onset of diabetes and obesity. Further research would be interesting to see how we can remodify this for safety of an individual.
Right. So, doctor, my second question would be, when should a diabetic patient consider bariatric surgery?
This is an interesting question. Any patient with type 2 diabetes who is on medication and lifestyle modification, and in spite of all this, his hemoglobin A1C keeps on rising or remains uncontrolled, and he starts facing long-term life-threatening complications, or his metabolic syndrome remains progressive, he has high chance of cardiovascular or nephrological disorders. And in addition to this, if the patient has erectile dysfunction or peripheral neuropathy, all of which are very distressing, may not be life-threatening but distressing, such an individual would have metabolic and bariatric surgery as an option of treatment for that individual.
Right. So, moving on to the next one. Can you elaborate on the role of bariatric surgery in the remission of type 2 diabetes and reduction of cardiovascular disease risk?
So, we have a clinical trial and few papers published which showed that gastric bypass has reduced hemoglobin A1C, blood pressure, lipid levels, the snoring, sleep apnea, improved activity levels, and altogether improved the metabolic syndrome. And there are published RCTs, level 1 evidences, which suggested that gastric bypass could reduce long-term cardiovascular risk of an individual. Over and above that, if pharmacotherapy is inefficient in treating or controlling someone's diabetes, the bariatric surgery or something like gastric bypass or a sleeve gastrectomy can help the patient achieve long-term remission from diabetes. Hemoglobin A1C less than 6 to achieve is very difficult with pharmacotherapy, lifestyle or anything, and even if we achieve, chance of hypoglycemia, because these patients are on insulin, is very high, which additionally is a risk. Bariatric surgery does not have that risk and can give reasonable freedom to lead a normal life, a healthy life with a reasonable diet, and I believe that if the diabetes is uncontrolled, this is a blessing in today's era.
So, doctor, do you think there is a lack of awareness among diabetes patients regarding gastric bypass surgery as a therapeutic option?
I believe there is definitely a lack of awareness among patients and even among clinicians. Even the long-term data, outcomes, how to take the perioperative care, I believe a lot more has to be done in improving awareness of this option being explored, at least for those who are extremely deserving. I see millions of patients who have BMI more than 35, they have uncontrolled diabetes and still are not exploring this option because they were never exposed to that option. The newer guidelines of American Diabetes Association have extended this indication for Indians, even for patients with uncontrolled diabetes and body mass index more than 30. We definitely see this being discussed in clinical meetings. However, in clinical practice, there is some apprehension. We don't see it as applied as much as it should be.
Right. So, doctor, lastly, do you think that an online community of doctors like Docplexus can be useful to share latest information related to diabetes?
Definitely yes. I believe the world has become large and better connected digitally. So online platform would be the best option to connect to patients, clinicians, doctors across the globe and improve awareness about best treatment options and better safety for patients.
Thank you so much. It was pleasure having you here.
My pleasure.
Thank you.
Thank you.